Nice to meet you. Thank you for coming. I want to talk about laser. I want to talk about stem cells.
Yeah.
You are a researcher about mesenchymal stem cells. How is the impact, the connections, laser and mesenchymal?
Right. So the whole field of stem cells is having discovered that we can make stem cells from any cell in the body, the induced pluripotent stem cell. We are now, I think the field is poised at trying to move it into clinical practice, which means can we differentiate them in a controlled way? Can we keep them stably differentiated to function in a particular way? So the whole field of programmed differentiation or directed programmed differentiation is very big. Now, many people are coming to this from small molecules or growth factors and biological factors, miRNAs, regulatory RNAs. But there is also a group of investigators who are looking at it from a biophysical perspective. Can we use physical devices such as ultrasounds, radio frequencies, and light to promote the directed differentiation? So we came to this from that angle, and our work has shown that if you use the right amount of light in the photobiomodulation zone, you can actually direct differentiation of dental stem cells and mesenchymal stem cells to a very specific lineage fate. So we can very selectively make either bone, dentine, or in our case, we have been trying to make cementum and other cartilage and other tissues.
You are talking about light, and this light is an impact of information, I think. How could you imagine that the information of this light could improve?
Right. So if you think about biology and chemistry, biochemistry, it is a physical process. Every ligand that binds a receptor is a physical reaction. The matrix supporting a cell is a physical substrate. So why is it surprising that light as a physical modality cannot provide the same information? So I think we try to make that argument because we also work with many biomaterials and scaffolds.
Yes.
And now at the level of understanding of the field, we know that besides being a passive substrate, the material topology can also direct fate. So having a very specific nanoscale feature on a material can direct stem cell fate. So it seems like a natural extension that any kind of physical process, whether it's light, whether it's ultrasound, whether it's radio frequency, can also do the same process. Now, we have to understand what that information is, and then we should be able to use it effectively and safely in a clinical.
Do you think this light is a cellular crosstalk?
There is lots of crosstalk. I think crosstalk is the basis of the cellular rigidity to change, and the interruption of this crosstalk seems to be one of the reasons you get a disease.
Yeah.
So I think light in many ways seems to correct this crosstalk, if you think about it, and synchronize these pathways to try and come from a diseased state to a healthy state.
Do you think we could measure this crosstalk of the light emission of the cells? That we could modulate it in another light of this biolight we need?
It would be possible to measure light, and I think there are studies out there talking about how there are low dose emissions of light, biophotons. Would it also change in disease states? That seems logical.
Yeah.
I think the most strongest data has come from circadian changes, diurnal changes of light emission. There are some really elegant recent papers because of better low noise digital cameras that can capture this change. So I don't think it's surprising that there would be a change in the biophotonic signature, and that would definitely be something worth investigating.
Investigate, very interesting. Talking about stem cells, we have different stem cells.
Yeah.
And just even in the oral cavity, we have some request stem cells.
6, I believe. So
Yes.
I mean, 6 is the number now.
6 is a number, yes. And we both are dentists. We are, in our mind, always very present dentistry. In our oral cavity, there are, for example, neuroquest stem cells. Do you think there are different, we need different lights for all the 6 different stem cells? Do you think we have to make decisions?
Logically, the answer would be yes.
Oh.
Have we found them? and the answer is not yet. Besides the fact that each cell is going to receive the light differently and respond differently, different light sources can also evoke different responses.
Yeah.
So people always talk about using blue in a particular situation, green in a certain situation, or red and infrared. If you don't worry about the physical property of light going into the tissue, the delivery part, the light wavelength itself can be informative. So I would not be surprised, and I think we are getting more data now, is that each wavelength has a particular response, and each cell type will probably need different wavelengths, different doses to respond optimally. We did an experiment with epithelial cells and fibroblasts, and with the same dose of light, the epithelial cell will respond much more quickly than a fibroblast. We found that the fibroblasts respond more slowly or at higher doses because they have higher levels of catalase, an enzyme that neutralizes the ROS. So one of the ways the photobiomodulation works is the induction of reactive oxygen species, ROS. So the increased catalase in fibroblasts neutralizes the light treatment, and therefore you need higher doses. So I think there is evidence that different cell types will need different doses.
In these stem cells, the chemical information is inside of the EVs. Do we have some experience the interaction with the light in EVs? Is there some research? Is there some idea whether there is a chemical interaction between these both parts, the chemical and the light?
So there is evidence that the chromophores actually change conformation when they receive light.
In the chromophore where?
In the chromophore. So if there is a light-sensitive molecule, we know that there is a change. When
With
there is
the aromats,
yeah. So I think we understand a lot from photosynthesis and cytochrome C oxidase. Those are classical photo acceptors or photoresponders. In other cases, it is not very clear how the light interacts with the biochemical structure, whether it is truly a sensing chemical change or is it a biophysical structural change. Now, the biophysical structural change we understand from rhodopsin. We know that the left and the right change of the symmetry results in a biological signal that is perceived in the brain as vision. We have also done work with one of our molecules transforming growth factor beta, where we show that light can change its conformation to cause activation. In other molecules, it's not so clear what the mechanism could be.
What the mechanism is. But the target are aromats. I think the targets are aromats, which are have the potency to resorb the light, and maybe the target is not only the light, there are other things like magnetic fields.
Sure. Yeah, so that's again a great area for research.
Yes.
Whether you
or scalar waves, for example, the target of the scalar waves also.
Right. So we don't understand enough of these phenomena themselves to understand how light would change it. But maybe light is a tool to study these processes. So if you think about it that way, it is very difficult in biology to study something that is not changing. We think of it like a black box, right? When you get a disease or you cause some treatment from the outside, you can change the structure and then look inside. So many of the questions that you're asking, I think the light can not only be therapeutic, which we were trying to do, but it can also be a tool to investigate biology.
That's very great. Yes, it's a good idea. Yes, and just even for the medicine 2.0, the prevention.
Right.
I think that's the best tool for the future we can have.
Absolutely. So I think as dentists, one of the biggest excitement in the field is the oral mucositis treatment. It is poised to become standard of care, which means that every patient who undergoes chemo or radiation must receive photobiomodulation even before they go for chemoradiation. So the data suggests that there is less incidence of pain, ulcers, and discomfort if you do photobiomodulation treatment before you start chemoradiation.
What do you think should it be the next step for a normal prevention?
Right. So that's a great question. I can answer that in two parts. The first one is there is a lot of interest now in light sanitation.
Light sanitation, okay.
One the best example is in your smartphones, you have blue light filters, right? because blue light in the night is not good for you to see.
To see, yes.
That's a good example of light sanitation. Many of the workplaces have dim lighting in the
Dim
night
light,
so that you don't get overstimulated. So if you think about it, that's light sanitation for you. That's a great place for us to start as therapeutic clinicians trying to do some treatment. The other side to that is too much light, right? So there is a lot of evidence now that the same devices that we can potentially use for surgical procedures can be used for photobiomodulation. The danger there is the threshold dose.
Okay.
So obviously, I would strongly recommend using a photobiomodulation device because it is safe and our patient safety should come first. But most importantly, understanding the dose threshold is really important to prevent any serious damage and maintain safety.
That means home device is not possible. That
Home devices are very attractive for access to care. Now,
Okay.
as clinicians, we know that many of these are chronic diseases and they need to come back to us repeated times. Sometimes they can't come or sometimes we can't accommodate their schedule. So it's always good for our clinical practice to send them home with something. It may not be as powerful, it may not be as effective, but it will still do the job. So that would be an ideal scenario where we have clinical units that we do clinical treatments with, and then you also have home devices that people can take home. So I think there is a place for that, especially I think the context would be chronic wounds,
Yeah.
which take months to heal. People have tried to make light bandages, they have tried to make light devices. So in those cases, there are situations where you need to come in to change the dressing, to do curettage. People are doing that with the high-power laser now to curate it. So those procedures can continue to be done in the clinical setting, maybe with a laser, and supplemented with photobiomodulation. But you can send them home with some device that they can actually continue treatment in between appointments.
back to dentistry.
Yep.
What do you think could light be for a prophylaxis in the oral cavity?
So there is a lot of interest in gingival inflammation. There are lots of mouth guards. There are now toothbrushes with light on them, which is fascinating. I get a call almost every week of asking about that, especially with blue-green light. I see a lot of work with that
Just in
wavelength.
China, yeah.
And I'm sure there is some effect. Now the question is, how therapeutic is it?
Yeah.
And I haven't seen good lab data supporting those views. But it makes sense intuitively if you think about it. Having a light on your toothbrush or a mouth guard makes so much sense.
Maybe it makes some sense, yes. Just even because you have so many photoreceptors in the oral cavity, and a friend of mine, Professor Neil Oswald, it's not for decoration. And maybe it makes sense to use these receptors in the oral cavity.
Absolutely. I think just like we are discovering new classes of medicines, pharmacology, I think light is poised to do that. And we often use the term photoceutical now to refer to light as a drug. And when you think about that, I think all the receptors are prime targets for new treatments.
Is really the sentence light is a drug a real sentence? Could it be?
It is a good concept.
Okay.
It is a good concept for us to start thinking about what light does to the body and what the body does to the light. If you think about that statement, it's pharmacodynamics and pharmacokinetics. I don't want light to be regulated as a drug, but I think it's a useful concept for us as investigators to look at this basic phenomenon.
What do you think is the next step in medicine with light?
I think photobiomodulation is poised to revolutionize healthcare. I think the more people realize that nothing in biology or medicine can do so many different things. But then again, if something is showing you clinical efficacy, there must be discrete mechanisms. So once we understand the mechanism, we will be able to do this more robustly, reproducibly, and rigorously, and in a safe manner. So that, I think, is the absolute turning point from getting from a concept to an actual treatment.
How do you think could we go inside in the brain of the dentist to make them understand what we could do with
So I think the dentist is at the forefront of photobiomodulation because of the treatment for mucositis. There is also a lot of evidence for temporomandibular disorders, as well as for orofacial pain, burning mouth syndrome, lichen planus. There are many different applications because there are lots of inflammatory and autoimmune diseases in the mouth, which this treatment can help. Besides the fact that it can help normal gum disease or periodontal disease by helping with the healing and stimulation of the regeneration.
Yes, thank you very much.
Absolutely.